There's a new warning tonight for people planning on swimming in a local lake or river. It involves swimmer's itch, and it can be a real problem. Dr. Frank McGeorge has some simple steps you can take to avoid this icky illness.
Lake living is great until the water you depend on for fun and sport carries a parasite that burrows into your skin. That's exactly what causes swimmer's itch, a parasite that requires two other things to multiply and invade: snails and certain birds like merganser or mallard ducks and Canada geese. Michigan is a hub for much of the research into the life cycle of the parasite that causes swimmer's itch. It was first discovered back in 1928 in a Michigan lake. Here's what happens. The parasites infect the bird, who then pass parasite eggs in their feces. Those eggs hatch and invade snails, where they multiply into the form that can burrow into a person's skin. Now, humans aren't the target, birds are, but that doesn't stop them from trying, and it's the attempt to literally get under your skin that causes the problem. When the larvae die, they create an intense allergic response that leads to the red bumps and itching. It isn't contagious and they aren't harmful as long as the bumps don't become infected, but the itching will leave you miserable for days. The treatment for the itching and redness are antihistamines and steroid creams. There are a few things you can do to prevent the problem. Using waterproof sunscreen is thought to help by creating a barrier over your skin to the parasite. Also, ask if swimmer's itch has been an issue where you plan to swim. If it is, don't get in.
You should plan to shower immediately and towel off completely after swimming in marshy water or water with a lot of ducks, geese, or snails. You should also avoid feeding ducks and geese that can bring in the parasite. And if you do get swimmer's itch, be sure to report it to local lake authorities. Treating your heartburn tonight could lead to allergies tomorrow. A new study shows people who have been prescribed drugs like proton pump inhibitors and H2 blocks also took more prescription anti-allergy medications. The author of the study says the allergies can come years after patients started taking heartburn drugs. Experts say it's because those drugs could trigger immune responses by disrupting the stomach's balance of acids and enzymes.